Hello, ladies and gentlemen. We seem to be passing through a very grim phase. The story that we had scripted, the screenplay that was there in the back of our minds, post lockdown, post national awareness of corona and the rest of it, seems not to be playing out quite the way we wanted it to. You've heard enough of it. So, today, very briefly, we will, I think, touch on two aspects which we think are of great importance, very relevant. And first point is that this controversy that has been raging all over, is India in the phase of community transmission or not? The latest person to be pleading the case on behalf of ICMR, we still don't understand why is it the ICMR, a research organization leading a clinical epidemiological expedition. It's still completely beguiling. We don't understand it. And the Ministry of Health of India have searched, I believe, from pole to pole, from meridian to meridian, and they have still not located an epidemiologist to lead us in this fight. So we have a wrestler in the swimming pool, and the latest wrestler in the swimming pool has been Professor Dr. Balram Bhargav, a very extremely distinguished person from the field of biomedical systems expert, a great research mind. But what is he doing in this jungle? The first thing that we as ordinary people need to appreciate is India, a landmass of 3.5 million square kilometers, cannot be thought of as a monolithic en bloc entity. The virus, as we last heard, is not yet subscribed to any nationalistic, mythological, political dispensation. So the virus does not recognize 130 crore people in a 3.5 million square kilometers. It picks out the region. It picks out localities, preferably urban, because that is where you have A, the introduction of infection, B, the required population density, and C, the lack of healthcare resistance, and D, bad planning. So when you have these four factors, the virus getting introduced in a population dense area of sufficient people, when you have ineffective mitigation measures in an ecosystem where the primary health mechanisms are really non-existent, all these places become very, very effective breeding ground for the virus. And this plays out over a period of time. When Italy was burning, we in India thought, oh right, it's their problem, not ours. When Maharashtra and Gujarat caught fire, the rest of India thought, oh dear, it's Western India, none of our problem, will never reach us. When it has reached Delhi, and Delhi is definitely up in flames as far as its healthcare is concerned, Chennai has already started feeling the heat. Who's next? Is it Hyderabad? Is it Kolkata? Maybe both. Because both have all the conditions, fulfill all the conditions we've just mentioned. But perhaps not Bangalore, because they have put up a good fight. Perhaps not any city of Kerala. They have put their act together so far. So this assumption that India is functioning as a monolithic epidemiological entity is mistaken, is wrong. Is there community transmission in Delhi where infectivity rates, I believe, are 50% or higher, if 1 in 2 people are infected? Of course there is. Is there Is there community spread in the urban pockets of Mumbai and Pune in Maharashtra? Of course there is. Has there been community spread in Ahmedabad? Of course there is. There may not be community spread in a remote district of Kerala or Orissa or northeast of India. So there are the hot spots of India where the infection is on a rampage. And I think ICMR, for whatever their brief and mandate are, I'm sure it is not ICMR's mandate to give a false sense of security, because if they continue to do so, then more and more states will be caught in this complacency cycle. The other basic perception, which I think begs to be clarified, and especially this was enacted out in all its dramatic content in recent times by the likes of Mr. Uddhav Thackeray. 90% of India doesn't understand what he speaks, because for some unknown reason he thinks that all of India is very fluent in Marathi. He has not really read up the schedule of languages in the Indian Constitution. And of course Mr. Arvind Kejriwal before he got the scare himself. And both of them have been sort of running from pillar to post, trying to teach a lesson to the private health sector. Private health sector today in India is almost like the mafia of Chicago. Each and every CEO or owner of a private health system is probably Al Capone reincarnated. That is a kind of cheap public drama that happens in recent times. Friends, the government only contributes 30% of the total health spending of India. 70% of health spending of India is a total private enterprise. It comes out from the pockets of the hapless citizens. It is spent both in government and in private institutions. Of the total healthcare turnover in India, which is to the tune of $200 to $230 billion, about 65 to 70% happens in the private domain. The rest happens in the government domains. Yes, government has a few more beds. It probably has a share of 11 lakhs to 12 lakhs out of the 20 lakh odd beds we have in the country. But God save our souls. Most of those beds are exactly what it means, just beds to lie on and very little else. There is an institution in India called NABH who does a brilliant work of doing quality control of hospitals. Let's go back and ask our capacious state governments that how many governments have ever bothered to get themselves quality measured according to NABH standards. So, if healthcare in India was to be a company, then the government of India, state and central added together, is a minority stakeholder in that enterprise. So the government does not attempt to control healthcare in India. It cracks the whip without contributing to healthcare. And since 2013, 2014 onwards, there has been two occasions when year on year, Government of India at the central level has actually contributed less to healthcare in absolute terms. Out of the 30-odd states in our country, most of them have got an increased share of the tax earned by the centre in the last 4 or 5 years. But look back at the figures, that how many of those states have ploughed back those numbers to healthcare, to education. They have not. We've spent money on advertisements. We've spent money on grandiose schemes. But we have this desire to control healthcare without contributing it. And the same private sector, which has to invest about 25 to 30 lakhs to get one hospital bed put up with half-decent facilities, at the drop of a hat, will be at the receiving end of the whip. Fair enough, private healthcare is no saint. They probably don't miss a chance to mop up a little bit more money from the market. But let us not live under the pretension that government healthcare is free. Government healthcare is not free, it is tax funded. Have we ever had a statement of accountability from the government that how much money is spent per procedure, per patient, and what is the justification of the taxation revenue? Very little money gets into it anyway. So in future, as Indians, though we all desire not to have another pandemic again, but before the government thumbs on the desks like Hercules, they've got to be contributors first and controllers next. And the story does not end with the story of health care. It also extends to health education. We live in an era when 58% of doctors are manufactured in the cash and carry medical education of the private sector. Hence the government has lost the grip, has lost the handle of getting those doctors to work in places where there is a dearth of doctors. And most of the so-called rural postings which are done, which does not have any respect for speciality, any respect for education, any respect for the minimum standards of human habitation. The government these days, most of the state governments will have to engage the young doctors by bonds so that, there is a lot of anti-slavery campaign going on all over the world today as a sequel of the Floyd-George syndrome. But the government of India does not hesitate to reduce. It does not create an environment where youngsters would go in and seize the opportunity to work. It creates substandard opportunities where doctors may be compelled to work as bonded laborers. So this is perhaps not the time for us to regurgitate our vile, but the question is that we may at some day count our losses, but also express a little debt of gratitude to this little virus to have exposed the shortcomings of India's public health infrastructure, how little the government contributes to public health and healthcare in general, and how sort of, ravenous is their urge to control healthcare. Let the government think. Let the government create for this moment an atmosphere of consensus, because trying to crack the whip when they do not own the whip, a rented whip, is not a very good instrument.
Like, share, subscribe and press the bell icon to never miss a video from News Sense.